When you are toxic, be it mold, be it yeast, be it dysbiotic, be it viral, be it anything, that toxic overload can be something that we can test, and then we might see it elevate. And that can damage the mitochondria. And when the mitochondria is damaged, you can have the fatigue, the pain. All symptoms can be caused by many different things. But if we lessen the blow in several different places, and it helps the patient's symptoms decrease in frequency and intensity, we know we're on the right path. And I think that's what I look for a patient, because often patients want it to be gone now. But I always say that it's about decreasing frequency, intensity, so we're on the path. And it didn't come now. It's taken years to come. So we're not going to expect it to go now. It's about actually having time. So again, toxic overload, I always say we can do other testing, but this is something that's one of the most important things that I think in terms of detoxification. You can detox, and that's great, but if you don't have routes for excretion that are efficient, that's not great. Sometimes toxins are more stable because they're, in the fats and stuff like that. So to wake them up, but not know where it's gonna go, might be actually more dangerous. You can't wash a tub without opening the plug. Because what will happen is all the water will float around and just go somewhere else, sit somewhere else. That's exactly like toxins. So even though we might find people are toxic, we wanna make sure that their gut is still functioning well, that the excretion pathways are open, so that we don't cause more problems. Neurotransmitters, so some of the clostridial markers, the markers can actually affect downstream pathways of several neurotransmitters. So I think it's very important to understand that how people are feeling, that gives them hope. They're not going crazy when they're feeling certain things. That's also very important. We're not testing urinary metabolites. We're testing urinary metabolites. We're not testing neurotransmitters in this urine test. And so again, looking at neurotransmitters, some of the metabolites that we see block certain enzymes, affect the pathway. That if you explain that to patients, they're like, oh, makes sense why I'm feeling this way. And there's something that we can do about it. Again, fatty acid oxidation, ketones, if people are diabetic, eating the wrong diarrhea, we can see that from these sort of testing. Again, nutrient markers, nutritional markers, cellularly also, so how it's working on a cell. It's not just about, I take this and it's in the serum, but is it reaching the cell? Is it doing its job? Gives us a good indication of certain things that you might have done in blood, and it proves it, be it CoQ10, be it your B vitamins. We also look at detoxification. And again, the methylation, looking at like the SMPs and things like that. Again, more metabolites for bacteria, looking at your glutathione, it gives you that and saying, hey, you need more glutathione, you need more antioxidants, So the test itself looks at so many different things. They actually have, the original use of organic acids was for inborn errors of metabolism. So they do have a part of the amino acids that in general, I normally see deficient in people who are vegan or vegetarian. Yeah, because we're not getting enough, protein. If we don't get enough amino acids, it actually downregulates our detoxification pathways. So it's not just the diabetes, it's also detoxification and toxic overload. So this becomes important in those people because you can actually show them that no, you're not getting enough protein or you're not absorbing enough protein. I've heard twice now, you are not what we are what we eat. And then I'm like, no, we're not what we eat. We are actually what we absorb. Yeah? So you're not what you actually eat, you are what you absorb. And that all, again, comes into the digestion, cofactors, and so on and so forth. In summary, very quickly, it is easy. It looks complicated. But if you know why you need the test, you will look for what's in the test. And that's very important. It is non-traumatic for a patient. So by the time people come and see me, they've done so many tests. One little P test isn't gonna hurt them, And it gives you a good, where should I start? Sometimes it's hard to know. I always tell patients, there's need to know and there's good to know, you right? I always stick with the need to know, because then you know what works when you try it. We don't need to use all our secret weapons.